Okay, so the first thing is we are going to talk about disruptive innovation in information technology. When we mean disruptive innovation means an innovation or a technology that changes how we do business. It's not something that make things a little bit more easier. It's something that interrupts the current business models and help create new ones. Okay, so we'll talk about things that happened in the past. Okay, and then based on this discussion, after we are done, we will start having a discussion on what technologies are there in the future. Right. So let's start our discussion. Okay. So this is the definition of a disruptive technology. So as I said informally, a technology that changes how we do business. It displaces or removes existing technology and replaces it. Okay. Now, during our history, during the human history, disruptive technologies have been there and they shaped our community. So the very first thing is the wheel and how it transferred, how we transport goods from one place or products from one place to the other, up till these current days when we talk about the metaverse, when we talk about blockchain technology, when we talk about cryptocurrency, right? These are new technologies that came out of nowhere, right? Before 2008, there was no such thing as cryptocurrency, bitcoins, and so on. And all of a sudden, they were there and they are taking over, right? So this is a very good example of a disruptive technology. Some technologies that starts very small, suddenly grows up and takes everything over, right? Right. Okay. When we talk about disruptive technologies, there are two things to talk about when we talk about technology in general, especially new technology. Two things. The first is the technology itself, how effective the technology is, how useful it is. Can it really change how we do business or not? The second hand or the second part of new technologies is, will people use this technology or not, right? My area of research, most of my research is in the area of healthcare information systems, health innovation, and healthcare technology, right? I have seen like zillions of very good systems that do a wonderful job in, for example, analyzing patient data, providing recommendations for physicians, and so on. But physicians refuse to use this system because it's hard to use. They didn't get enough training. It doesn't concise, or it doesn't appeal to their professional experience and so on. So when we come up with a disruptive technology, that doesn't mean that this technology will be used by everyone, right? So a very famous example of this is, I don't know if you guys know that, or are you too young for it? But a few years ago, there were many technologies that suddenly came out and then disappeared altogether. Things like music sharing applications. So there were so many music sharing applications that depended on peer-to-peer sharing, people sharing music among themselves, and they were very popular, and then they died. Okay, they went away, and so on. So there are always new technologies that show up in the market, but because people do not accept these technologies, they die away. Okay, this is very common, and this is something that is called a dilemma for new innovations. Yes, it was a legal thing. So Abraham, legal thing is part of it, right? So legal thing or is part of the technology is there, right? We had this technology. The technology of sharing music is there, but it faces challenges. One of the challenges is legal challenges. Another challenge may be people not accepting it, as I mentioned, right? So I'm sure. Can anyone can anyone think of a technology that was there but people did not use because they just didn't like it?
Oh, I was gonna say the predecessor to Google Glass was the something like Cosmo something or another. Basically, it was like Google Glass, but like back in 2008.
Yes. So this is a great example, right? So Google Glass, I will look at everyone. So Google Glass is a great example of this. So it was a new innovation, and Google tried to market their products. So you could have in their marketing campaigns, you could see physicians wearing these glasses and looking at patient information, moving to surgery rooms and so on, operation rooms. But people didn't like it. They did not like the fact that they would wear glasses and see the information there. So
Oh, no. Before Google Glass came out, the exact same concept was tried out in the early 2000s or
Mhm.
mid 2000s.
Yeah,
And same thing, no one really liked it.
yeah, right. So Nicholas mentioned, Shane, I'll come back to you, Shane, in 1 minute, but Nicholas mentioned first. So Netscape, for those who don't know, Netscape was a browser, internet browser that was very famous at the beginning of the internet, and then it died. Okay. Uh, um, but it's not because people did not like it. I think it's mainly because uh, it fell behind in terms of technology. So the problem here is not that people did not like it. I loved Netscape, but other browsers started to show up that are um, they are easier to use, and people prefer them, right? So I think the technology was behind that. So Sheen, do you have another thing?
I was going to say electric cars back in like maybe, well, I'd say pretty much anything before Tesla. So I mean, they came out with electric cars in like the 70s that were, you know, super
Yeah,
small and tiny, like, you know, nobody really bought it. It wasn't until Tesla really kind of came out with like that it
yeah.
was actually taken seriously.
Yeah, right. So there was this is also a good example, because electric cars, the technology is there, but people did not like it. Did not like it because of limitations in the technology itself, right? Small ranges of the cars, or they didn't look good. They were too small, so people did not like it, right? So you can have a great technology, but because people don't like it, then it shows it's not there anymore. And the one that I like most is the Google Glass example. Google Glass is a great, if you think about it, it's a great innovation, and it can be useful, right? But it just didn't click with people. People thought it's too expensive, too hard to use, interrupted with their day-to-day operations, and therefore they are put aside. It's still there, and I'm sure they will show up again sometime in the future. But for now, it's not. For now, it's not there. Right? So this is a great example of such technologies. Okay, so these are some videos that I usually show when I'm in class, but we are not in class, so I will not be showing videos now. Let's focus on um, the rest
I
of
just
this.
rem I
Yeah,
just remembered something else.
yeah,
Those cell phones that they were coming out for a period of time, that actually had that like Motorola Landsat chip inside them. So they were actually not just regular cell phones; they were also like satellite phones as well. But people didn't like that because it was too freaking expensive.
yeah. So yeah, so that's a nice idea, and I have discussion about that later on. So later on in the course, I will discuss this particular case about these uh, satellite phones. This was a company that was created with $500 million in funding, and they launched satellites, and then they had to sell all the satellites for $2 million or something like that. So we'll talk about that in this course later on. So thank you so much for mentioning this. Yes, right. So how do we detect disruptions that matter? How do we detect technologies that we can use in our businesses? We talked about that last week. We talked about surveying the the market and looking at the external analysis of the market to find out what new technologies are out there and how we can take advantage of these opportunities. So these are some of the properties of the technologies that help you make a judgment whether to use these technologies or not, right? So one of the components, one of the big components is the user experience, right? So if you are doing research in information systems like I do, then you know that one of the biggest areas, one of the biggest factors that impact the use of new technology is people's perception of these technologies, what people think of the technology, not the technology itself, right? So uh, something like how easy it is to use it, right? If you are selling technology to a physician that is very hard to use, a doctor or physician does not have the time to learn this new technology, and therefore he will say, no, this is a very bad system and I'm not going to use it. Okay, I have seen this firsthand. So I was working on developing a very good system. Right now in the US and in Canada, I was working in Canada back then. In US and Canada, opioids and excess use of drugs is a big problem, and it's causing thousands of deaths in the US, right? So we came up with a system that makes physicians not prescribe too much opioids, they don't prescribe too much drugs to the patients. And we included this and we gave it to the physicians to use. They didn't use it, even though it's very useful. It's very important for the community. They did not use it because they felt it is too hard to learn. Okay, so if easy to learn systems are more likely to be used than harder to use systems.
Wait, so the doctors didn't implement it because they thought it was too hard to learn? Didn't they go through like years of schooling and education?
That's a great point. Okay, so I'm not sure if this is the right time to talk about that, but this is a great point. They have a long time and they are very smart. They spent many years studying medicine and practicing medicine, so they are smart and they are good at studying. But how they look at information system as something outside of their scope of business. We are physicians, we are not IT people, right? So you give us something that we can incorporate on our medicine practice. Don't give us something that we need to learn and spend time incorporating into our medical practice. This doesn't work for physicians at all. Okay, right? So physicians, if you I hope you don't go to physicians, you don't visit hospitals a lot, I hope so. But if you do visit hospitals, you will see that a physician spends very few minutes with you, 15 minutes. If this is a specialist, maybe 30 minutes. So if the technology doesn't fit seamlessly into the workflow, into the time of the visit, then no, we are not going to use it. We're not going to spend 5 more minutes trying to work through your system. We will use our traditional ways. We know what we are doing, right? So they are going to drop the system if it doesn't belong or it doesn't fit into their current workflow. This is something that is very common with physicians. Very common. Okay, keep that in mind. Yes, yes, Shane. Yes.
I was going to mention I've been in a lot of hospitals a lot of my life. It's not uncommon to see doctors, nurses, any medical staff really, that they don't know how to even work Excel or even Word. Like it's unknown to them basically. And a lot of them don't even know how to set up their own printer system. And for example, here in Monterey County, I believe a lot of the companies use Epic out here. They consider it so beneath them. A lot of these places, like they'll only keep like a minimal staff. So basically their system's always shutting down and they're complaining about it. But it's just because like, well, what do you expect? You have like 2 or 3 people working for the entire county.
This is exactly my point. Thank you so much, Abraham, for mentioning that. This is exactly what I was saying. So physicians are so good at what they do. You go to them, they will look at your X-rays, they will diagnose you. But when it comes to technology, they can learn it. If they want, they will learn it, but they don't have the time. Time for them is money, right? So they are not going to spend time learning new technologies. Someone else should do it for them. This is their point of view. I have relatives who are physicians, like sisters and stuff like that. They ask me to set up their email and all of this stuff. Okay, so by the way, guys, health informatics, health information systems is one of the greatest areas to go into. In the US right now, there is a big lack of staff working in health informatics and health information systems. So if you can get into this area, you will get good jobs. I promise you that. Yes, Shane, you had a comment.
I was going to say that my dad used to work as like an insurance adjuster, and he'd say doctors were always the ones who didn't like pay their bills or do like just simple stuff. It's like, you know, it's not that they didn't have the money to pay. It's just they just didn't do it.
Right. Shush. So there are many of you guys who agree with me. So this is the point I want you to see here, right? Ease of use is one of the key things. This is not just in healthcare, but in other areas as well. So um, okay, so many of you were in my courses last semester, Business 308, and I shared with you a system that I built, right? Call Buddy, a system that I developed last semester, so my students can share ideas, can participate together in projects. I didn't share that with you this semester because I didn't have time. Maybe in the future I will show that to you. Anyway, my students tested this in the first semester, and what they found is it was good, but it was very slow, right? So the system is useful, but very slow. So no one is going to spend a minute accessing a system and trying to work through the system. So what I did is I improved the speed. I moved it to a different host and changed the structure of the system to make it faster. So you can create the best system in the world, and it can be very useful. But if it is too slow, if it is too hard to use, then people are not going to use it. Trust me with that, right? This is the biggest thing. So the biggest thing, there are two things that make people use a system or not. First, if it's useful for them to do their work, right? And the second thing, if it is easy for them to use, or they find it hard to use. And easy and hard is relative, right? It can be hard for me and easy for you, or the other way around. Okay, so this is subjective. These are perceptions. These are not really. There is no such thing as a system that is easy for everyone or hard for everyone. It's perception, right? For businesses, the other concern when they think about adopting a system is the business model of the system. So will this system or this new technology help them make more money or make them more efficient in what they are doing or not? If it does, then they will adopt it. Okay. Again, as several examples we can talk about is we can talk about things like the healthcare as well. So healthcare systems in different countries are differ, right? In the US, the healthcare system in the US is focuses on making profit, right? So if they find a system that will save them money or help them make more money, then they will adopt this system as a hospital, right? The hospital will buy this system and will ask the physicians to use it. But whether the physicians will use it or not, this is a totally other story, okay? I'm talking about business level. There's a difference between business level and user level. A business may adopt a technology, but the users may not use it because they don't like it, right? And again, this happened in many cases in the US. In here at CSUMB, we can look at Canvas in the same way, right? If you look at Canvas, Canvas provides efficiency to us, the teachers or the professors. We can use it to create content easily, share content, and so on and so forth, right? So CSUMB adopted Canvas because maybe it was cheaper for them to buy. Maybe they believed it provided better service to their improve the efficiency of the people working at CSUMB. But for me, the most important thing for Canvas is it's easy to use. For me, it's very easy to use Canvas, right? Right. So these are all factors, and we will go through lots of case studies and lots of examples in this semester that shows you the impact of user experience and business model on using technology in a company. We'll see some examples of very easy to use technology. We will see examples of very hard to use technology, and we'll see what you guys think about that.